Hi everyone, my name is Dr. Rabia Aydıbeköprülü. I'm from Istanbul, Turkey, and my team friend from Turkey too, Association Professor Mehmet Evren Okur. Today I'm gonna talk about our research, which one efficacy of Vincamin on alloxan-induced diabetic rats on renal size, serum creatinine, and urine levels. Diabetes mellitus is identified by hyperglycemia induced by a deficiency of insulin secretion or insulin activity. It causes a variety of systemic abnormalities, including kidney impairments, neuropathies, ophthalmopathies, reproductive, and some cardiovascular disease. Patients have change in kidney function, such as urea and creatinine levels on diabetes mellitus. And in this study, evaluated the effect of Vincamin on renal dysfunction in alloxan-induced male rats by measuring fasting blood glucose, serum urea, and creatinine levels. Vincamin is a monoterpenoid indole alkaloid that extracted from Catharanthus roseus, and Vincamin has effects such as anticoagulant, memory enhancer, neurotropic, hypoglycemic, hypolipidemic, and vasodilator. Vincamin has been shown to improve brain metabolism by affecting ATP production and glucose and oxygen utilization and increased short-term defense against hypoxia and ischemia. In light of this, study was carried out to investigate whether Vincamin may have a beneficial effect on diabetes-related changes in kidney function, such as urea and creatinine levels. Aim of this research to prove the positive role of Vincamin on creatinine and urea levels, to prove the Vincamin improve renal size, to investigate the effect of Vincamin on renal dysfunction. We measured fasting blood glucose levels, serum creatinine and urea levels, and renal sizes. Approved by the Istanbul Medipol University Ethics Committee, experiments were performed at Istanbul Medipol University Laboratory Animals Department. And in this study, we used Wistar albino rats, and rats were unsystematically separated into 4 groups. Group number 1, untreated healthy group. Group number 2, untreated diabetes group. Group number 3, Vincamin treated 20 mg group, diabetics group. And the last group is Vincamin treated 40 mg diabetes group. After the rats were diagnosed with diabetes, Vincamin was administered once a day for 40 days. Fasting blood glucose levels were assessed in all rats after 12 hours fast with free access to water with alloxan monohydrate 150 mg. Dissolved in sterile saline sodium chloride 0.9% and pH 7. Injected intraperitoneally into rats for induction of hyperglycemia. Rats were considered hyperglycemic when fasting blood glucose levels were above 250 mg. Following the last dose, the animals were fasted overnight and sacrificed under anesthesia. Their blood was collected and centrifuged. The fasting blood glucose level was analyzed by determining the blood sample from the tail vein with a glucometer using the glucose oxidase technique. Serum creatinine and urea levels measured from serum. When we checked the renal size, we thought that we don't have meaningful results. And when we checked the past research and investigate, we understood that maybe our time was not enough for the measure the changes of renal size. So we don't have meaningful results for it, but we have meaningful results for glucose levels that Vincamin has improved fasting glucose levels when we compare the diabetes mellitus group, and Vincamin 40 mg is better results when we compare. And when we compare the real levels, it is the same results. When we check serum levels on control group and vincamin treatment group, we have a beneficial result. And it's the same result for the creatinine. So we can say that, yes, maybe vincamin has a potential preventive effect against diabetes-related kidney problems, which would be attributed to its antioxidant activity. In order to expand these promising results and take their place in the literature, larger and more projects and studies needed. As a team, we are taking and developing our steps for this study. Thank you for listening to me.